I'm Brandon Stahl. I'm a urologist. My background starts in University of Vermont, where I graduated college. I went to medical school at Boston University, and then I did my urology training at the University of Iowa for 6 years before I head back to the East Coast after that. I decided to go into urology because of a mix of being able to interact with patients in the office and doing procedures in the operating room. They have a lot of advanced technology in urology, which is really kind of interesting and fun to keep up with. It really keeps you on your toes for continuing medical education and that kind of thing. So in terms of what patients I'll be seeing, basically all adult patients, men and women, various disease processes. This includes urinary incontinence, kidney stones, kidney cancer, prostate health. So basically any adult patient. So in terms of how I practice, I really like to practice as a collaborative approach. So when patients come in with a problem, whether it's cancer or kidney stone or anything else, we really kind of take it step by step, break it down in terms of what needs to get done and what should get done, and then in the end, I provide the information, and the patient ultimately makes the decision about what to do. So one of the most rewarding things about my job is seeing people bopping around town, months or years later, and kind of realize that you kind of help them through a tough patch in their life. One piece of advice I would give patients when, talking about general health care and what they can do better is, for my kidney stone patients, it's to drink a lot of water. And for most of my male patients, it's to do regular routine prostate cancer screening. For me, joining Great River Health was a combination of something personal and something professional. So the personal link to me was, I know the current urologist here, Dr. Consavalos. He and I did training going back to 2003, so I've known him for more than 20 years at this point, and we're friends. The other is the hospital itself. It's a nice mid-sized hospital that's very independent, and I felt like I would be able to come here and practice the kind of high-quality care at a community hospital so the patients don't have to travel a long distance to get that kind of care. So not at work, myself and all of my family, we like to do a few things. We ski and scuba dive. So in the winter, we try to ski as much as we can, and in the warmer climates, we try to do some scuba diving.